Good day, viewers at home. Welcome back to my channel. My name is Deborah Bolaji, your favorite mental health nurse. I'm here today to talk to you about something very important, and our topic today is psychophysiological disorder. Don't bother about the grammar. What it means is how your mental health can affect your physical health. How your mental health can affect your physical health. Alright, so let's go to psychophysiological disorder. I'm going to tell you a story to make you understand better what I mean by psychophysiological disorder. Mr. Tony is a very young man and a very hardworking man, but not yet married. The parents are actually giving him a lot of stress, like putting him under pressure to bring in a wife very soon for him to settle down. But even at that, he's stressed at work as well. He goes to work every day around 6, 7 and comes back home around 10 p.m., 11 p.m. and resume back to work same time again every day. Is really under pressure. Work pressure is there and family prayer for him to get married as soon as possible is there as well. Mr. Tony went to his clinic of recent, and by the time they checked his blood pressure, it was very high, above 160, 100. And the doctor asked what really happened. Mr. Tony explained the prayer has been under, the family prayer and the work prayer has been under of recent. And apart from that, the doctor gave him some medications to use and referred him to see a psychologist. Alright, so what is really happening to Mr. Tony? The doctor eventually diagnosed him of essential hypertension, PEPTIC ulcer, and why is this? Mr. Tony has actually been facing a lot of pressure, not really the stress at work, but because there are a lot of emotional pressure now affecting his mental health, affecting him psychologically. So this tends to aggravate his physical ailment, which is the hypertension, which could have been managed and it should have returned to a normal blood pressure limit. But because he's not taking care of his mental health, this has really affected him. So today, like I said, psychophysiological disorder is when your mental health, because there are issues that are affecting your emotions, affecting you psychologically, now aggravating your physical illnesses. Now you understand. Okay, so what are the causes of psychophysiological disorder? Number one cause is idiopathic. What do I mean by that? Idiopathic means that there is no cause. You cannot link it to anything at all. You can't link it to hereditary. You can't link it to maybe this is why, the main reason why this has happened. Number two is hereditary. Yeah, it can actually be passed from parents to their children, and if a relative has such disorder, there's likelihood of such a person getting such disorder. Number three, there is stress, which has been one of the major factors that has been affecting this disorder, that can actually lead to the disorder. Emotional factor. Number four is emotional disturbance. Yes, we all go through some emotional disturbances at some point in our lives, like Mr. Tony, the example I gave. Prayer, bring home a wife and he is not yet ready, or because of one reason or the other he couldn't do that, and the parents kept on putting him under prayer because of this, and just because of that his work too is putting him under prayer. There are targets he must meet at work. He must not come late to work. He must meet some targets that are just so much, and these are really affecting Mr. Tony. So these are the things that can lead to psychophysiological disorder. Now you may want to ask me, what are the examples of psychophysiological disorder? Number one is essential hypertension. When your BP is consistently high without anything, even when you use medications, it is still high. That is essential hypertension. And anything above 140, 90, is hypertension, and when it is consistently checked and you are having above 140/90, then you can be diagnosed of hypertension. Number 2 is peptic ulcer. Like I explained, Mr. Tony, because of his nature of work, sometimes he does not even remember that he has not eaten in the day until late in the night when he gets home. Even when he gets home, he's so tired to cook and he only eats junk, and this has led to having peptic ulcer. Another example is migraine. Mr. Tony, that's one of the complaints he gave the doctor. He has always been having headache at a certain area of his head, and he has been complaining of this headache persistently. He has been using so many medications and still there is persistent headache, and the doctor diagnosed him of having migraine. All is just part of an example of psychophysiological disorder. Another example is coronary heart disease. Yes, your mental health can actually aggravate all these things. Now, get this point right. You can actually have those examples that I have listed without, but what I'm saying is that when your mental health, maybe there is any issue with your emotions, there is any issue with your mental health, when your mental health has been affected due to one factor or the other and is now aggravating those symptoms, this is what psychophysiological disorder is all about. Now, treatment. How do you treat psychophysiological disorder? The treatment is very simple. Yes, you need to know the very reason, the very thing affecting your mental health. You need to pay attention to that very thing affecting your emotion, giving you emotional disturbance. Is it your work? Are you stressed? Is it because of family issue, work issue? You have some issues that you're going through in life, and this has been affecting your mental health negatively. This can actually lead to psychophysiological disorder. That is, the ailments you are complaining of are getting aggravating it, and you are treating it, but there is no sign of treatment at all. So you have to know the very thing affecting you. What is the cause of this? What can actually be affecting my mental health? When this has been ironed out, you can see a psychologist. There are some of their instruments they can use for you to know what exactly is wrong with you. It may be something you are not even paying attention to at all, and that is what's affecting your mental health. Alright, so now that you understand the treatment, visit a clinic. Okay, if you have treated the ailment and you see that you are not getting better, then see a psychologist, and with all this treatment you see that you get better, and this disorder is actually treatable if it is early detected. Thank you very much for joining me. If you are new to my channel, don't forget to subscribe, and to my returning subscribers, thank you so much. I really appreciate it. Thanks for your support, your comments. I see your comments, I see your likes. Thanks so much. I really appreciate you all. Alright, see you next time. Bye.